Welcome to Module 5 of the ANDVSA Member Program Primary Prevention Orientation, the Primary Prevention Plan. In this module, we are going to move further through the steps to community mobilization and address the steps that our coalition will need to take in order to develop a primary prevention plan, which is a huge step in the process of eliminating violence in our communities. In this module, we will discuss the components of the primary prevention plan. We will also address how to approach your community with the idea of prevention. In Module 4, we introduce PIES, the framework that guides prevention capacity building. In this module, we will focus in on the planning process that local DVSA prevention coalitions will undergo to create a prevention plan for their communities. Many things bring together community planning processes. Communities may come together because of a pressing issue in their community, to satisfy a grant requirement, or they may come together to create the ideal conditions for health and safety in their community. Communities may be looking to address a variety of pressing issues such as suicide, substance abuse, or violence, or sometimes you will find a plan that works on one area, such as improving safety, youth success, or other topics. Whatever the case may be, we can set ourselves up for success by considering the best approach for developing a plan with partners and community stakeholders and how a plan might benefit our work to prevent domestic and sexual violence. So what is a primary prevention plan? Effective primary prevention plans are usually created by a broad range of stakeholders or a local prevention coalition. The plan usually has some core components of a community's approach to eliminating domestic violence and sexual assault, including underlying philosophies, some background of the community and needs, specific goals and outcomes, and evaluation approaches. This document can act as a roadmap to organizations that work to develop and implement prevention strategies and those who have not always been traditional partners. It provides a shared vision and a clear direction to achieve goals within the community. It helps to ensure that partners are using the same language, have similar priorities, have clear pathways, and have a way to measure their success. Since the art and science of prevention requires a comprehensive and coordinated approach, this planning approach can be a significant tool for the community. Like most situations, we do not usually jump in until we have a clear picture of what is going on. As we get started, it is important to do the same in our communities. So, as a coalition, we take steps and use tools to understand what is going on in communities. These are often referred to as needs assessments, or sometimes a scan. Going through the collaborative process of a needs assessment and prioritizing goals together can be important to ensure long-term success. There are many tools to use, but ultimately, a needs assessment is a way of understanding our community through various kinds of measurements such as demographics, economic characteristics, strengths, assets, and influential factors in the community. Sometimes, finding some information about prevalence, as well as demographic, crime, and medical data, will be the most readily available to us. But we may be looking to understand specific risk factors related to gender norms or community members' attitudes towards domestic and sexual violence. For this, we will need to think of some different ways to approach data collection, such as surveys, stakeholder interviews, and focus groups. We might consider creating a survey if we wanted to reach a large group of people, establish focus groups if we wanted to obtain verbal feedback, or we might want to get answers to complex questions from those knowledgeable about domestic violence and sexual assault in our community. As we consider paths to acquiring this data, we need to be certain of both the benefits and drawbacks of each method of collection. We also want to make sure that our collection method makes sense for our community. For example, we wouldn't want to ask community members to take an online survey in a remote community where citizens may find it difficult to access computers or the internet. Or, if we were looking for numerical data, we might not want to use a focus group approach. Once we have our initial coalition formed and we have identified some key areas for prevention through our needs and resources assessment, we have a much clearer picture about what we would like to work towards changing or strengthening. Next, we need to figure out what exactly we hope to accomplish. So, we're going to need to do some goal setting. In a perfect world, what do we hope to see or not see? If we lived in a society without violence and with many of the protective factors in place, what would it look like? So what does a goal actually look like? Our goals should be broad statements that describe change that we want to see in our community. In creating our goals, we need to recognize the importance of context and relevancy. Goals are not something that we pull from thin air. Rather, they are based on the data that we collected in our needs assessment and community scan. Let's take a look at the Ketchikan Intimate Partner Violence Prevention Plan to see what we mean. There are 3 goals laid out in the Ketchikan IPV Prevention Plan. 1. Ketchikan has a community climate that promotes equality, respect, and safety in relationships. 2. Youth understand and demonstrate their individual power, choices, and responsibility for healthy lifestyles and choices. And 3. Families are supported to practice and promote safe and healthy relationships. Now, how did they come up with these goals? In 2007, before Ketchikan's Prevention Coalition existed, a needs assessment was conducted to understand community members' perceptions of a number of issues in the community. There were 3 key issues that community members found especially important: affordable housing, substance abuse, and dropout rates, all risk factors for domestic violence and sexual assault. Also, the needs assessment determined 6 focus areas to promote community wellness by coming together around youth, a diverse year-round economy, people in crisis, overcoming racial divides, the cost of substance abuse, and improving collaboration of local residents. From the needs assessment, the Ketchikan Wellness Coalition was formed along with its 7 task forces, including the Ketchikan Prevention Coalition, called the Promoting Respectful Relationships Task Force. Upon its creation, the PRR Task Force looked back at the community needs assessment and considered the findings and focus areas. The 3 goals of the Ketchikan IPV Prevention Plan incorporate elements of the 6 focus areas to ensure that any programming developed makes sense within the context of Ketchikan's community climate. So now we have our goals, which is great, but they seem a little lofty, don't they? We need to think of a way to make them a little more tangible. We can do that by thinking about our desired outcomes. Outcomes are statements that break down our goals into specific, measurable pieces. A simple mnemonic device, A, B, C, D, E, can give us a good idea as to where to begin. It's most logical to start by considering our audience. Who will change? Remember, we are thinking about creating change across the social ecology, and this means that our audience may be more than just an individual. Next, we'll need to consider our behavioral objectives. What will change? For our purposes, our desired outcomes will revolve in some way around reducing domestic and sexual violence in our community. We just need to figure out how exactly we want to define it. Again, it is easiest to think directly about changing perpetration, but with primary prevention, we are looking at changing behaviors in the community that allow for violence. Then, what are the conditions of our outcomes? When do we want our goals to be accomplished? We need to define our timeline for reaching our target. How long do we think it will take to accomplish our goals? As we set our timeline, we need to find that delicate balance of being realistic with our goals, yet bold enough to show our intention of making real change in our community. Now, to what degree do we hope to make change? This really means how much change do we believe we will see? Once we have figured out what our outcomes are, we will need to decide how much change we expect to see in that period of time that we have just defined. And then finally, how will we provide evidence that we have achieved this outcome or milestone? Let's look at an example. One of our goals may be that men will play a greater role in preventing domestic and sexual violence. We might consider measuring this by carrying out a survey of male leaders or role models and asking their understanding and how they can get involved in preventing violence. When we are developing outcomes, we might consider quantifying how many men who have participated in prevention programs have increased their understanding of their role in ending violence or feel empowered to promote and practice healthy relationships. And finally, we want to establish a target so that we have something to work toward. We might say that we would like to see at least a 30% increase in men's understanding of their role in promoting healthy relationships or healthy concepts of masculinity. So now, how are we going to accomplish our goals exactly? If our community is just starting out with prevention, it might be beneficial for our coalitions to do a little bit of brainstorming to figure out how we can build on the strengths and context of our community to develop strategies. While we may come up with many brilliant ideas, we still need to consider our capacity as a coalition to implement these strategies across our timeline. These strategies will again consider the elements of ABCDE, our community context, priority risk and protective factors, or underlying structural issues that act as barriers to health and safety. Whatever we choose to use, we need to think of it within the context of the social ecological model. We should consider how we can effectively work across the model and how strategies could fit in with what we know about our community based on the needs assessment. Choosing good strategies takes a team. First, we need to understand if there is an evidence base for strategies needed in our community. How can we build on this or adapt this to fit in our community? Now, let's think about our capacity in terms of our human resources. The Prevention Coalition will have to give careful consideration to additional partners and structures for implementing the strategies. Do we have an organization that has staff devoted to this strategy? Do we have community members that have expressed interest in volunteering to help develop and operate programs? Who in the community at large is going to help us promote our prevention work? Looking at our community, what other organizations or entities have a stake in eliminating domestic and sexual violence? Local schools, a community center, local law enforcement, or maybe healthcare or media outlets? We already have many of these stakeholders on our Prevention Coalition, but now we might have new insight into how our work can overlap, and new stakeholders might have an interest to help choose, adapt, and implement strategies. There are some stakeholders who are involved in the needs assessment, planning processes, and strategy development, and will have high ownership to ensure the plan succeeds. These partners may be able to easily identify potential roles for themselves. Other stakeholders, such as teachers, coaches, health professionals, or youth group leaders, may not be interested in the planning process, but may be interested in getting involved when a strategy relates to their work. A partnership means working together, compromising, and sharing the work and success. Through planning and our prevention work, we will build partnerships and we will really get to know what is important to our partners, to their organization, and to their projects. We will understand the ways in which the prevention plan will help them to accomplish their own goals, and what parts of the prevention work they will be most interested in being involved in. For example, a school might be driven by student success. Preventing violence in the community could lead to better grades and to a decrease in dropout rates. Knowing what drives partners to get involved with prevention is key to keeping them involved and motivated. The other side of the capacity piece is asking what we have to do this work with. What resources do we have at our disposal? Do we have money, or how about community resources? We will want to refer to our resource map to help us answer this question. What resources do we still need to identify? What agencies may pool funds to achieve a common goal? Or which agencies are able to apply for or access resources? Any prevention programming that is already underway is also a resource for our community. Not having available resources should not stop a community from moving forward with a strategy, but it will require consideration for your timeline and the steps needed to pave the way for that strategy. Okay, so we figured out how we're going to tackle domestic violence and sexual assault in our community, but eventually we're going to want to share it with other people. Creating a public plan is a great way to put the word out about prevention in the community, and it is a necessary component for funding consideration. So, let's take our plan one step further and talk about what we should include in a public prevention plan. There are many approaches to creating a plan, but here are some possible components. In addition to discussing the main reasons the plan was developed, we can also include information about contributors, a review of prevention-related concepts, some key risk and protective factors, and some of the key demographics, challenges, and assets in the community. You may choose to focus in on different pieces of data to underscore the main risk and protective factors or prioritize areas from your plan. What is important is to make the link between the community concern addressed, the data you are highlighting, and the approach you are taking to transform domestic violence and sexual assault. Before we put everything we know about prevention into our plan, though, we should consider how much information is too much. We want our audience to be informed, but at the same time, we don't want them to become disinterested or overwhelmed. If we choose to include more background information about prevention, we might want to consider the physical layout of our plan and how we could use it to our advantage. This is a good tip that we can use on the entirety of our plan. We should be just as cognizant of how we are presenting our information as we are of the information itself. So, as we assemble our plan, we should make it as eye-catching as we can. Include some pictures, some tables, some boxes, anything that can make our plan look sharp. Finally, we want to make sure that whatever we design is developed with longevity in mind. Evaluation, continuous quality improvement, and sustainability should be discussed from the beginning and built into our plans rather than thrown in as an afterthought so that we can demonstrate that what we plan to do will have lasting impacts in our community. If you are ready to develop a prevention plan for your community, but you want to see how other communities have done it in the past, you can view domestic violence and sexual assault prevention plans from Juneau, Ketchikan, and Sitka, as well as the most recent Pathways to Prevention Statewide Prevention Update. This wraps up Module 5. Join us for the 6th module of the ANDVSA Member Program Primary Prevention Orientation, where we will discuss developing effective programming that addresses risk factors and promotes protective factors in our community.